Welcome back to American Medicine Today. I would like to welcome to the program Jonathan Wrightson. Jonathan, why don't you tell us how you came to be in pain? Were you in an accident, or was this just wear and tear degeneration over time?
It started many years ago, just about 3 decades ago. I fell in the back of a truck, a big rig working at UPS, landed on my back. And ever since then, I've had some issues. And then I joined the Marine Corps just about a year after that. And it just got progressively worse in the Marine Corps to the point that I got medically discharged after 4 years. And so it got a little bit better. And I've just kind of dealt with it for the time being. And for the last 30 years. And it would flare up, put me down for a week or two.
So why don't you tell us where on your body you felt the pain and how that was impacting your daily activities?
It was in the lower back. It shot down the left leg. The sciatic nerve is what everybody diagnosed it as. And it would get intense to the point that I would have to lay down.
Did it cause any weakness in the leg when you would walk?
Yeah, it did, especially the last 7 months before the surgery. It got really bad. I mean, to the point where I was just twisting my ankle almost on a daily basis. It was pretty rough.
Okay. And what did you do at that point? What type of treatments did you utilize? Did you use medicines? Did you try conservative type treatments to help?
Yeah, I went to a chiropractor. I've been going to a chiropractor for years. I felt like maybe it was helping, but obviously it didn't, because it just would flare up so bad at times. And so then here the last 7 months, they even did an epidural about 3 months before I came down to Bonati Institute. That didn't help. I mean, it didn't touch it. And I was on pain medicine pretty much the last 7 months. I lived on pain medicine, and I'm not a pain medicine guy. I hate the stuff. I know too many guys that have gotten hooked on it. But I couldn't even work. I own a real estate company and a remodeling business of my own, and couldn't do anything.
Well, where are you calling in from?
From Emerald Isle, North Carolina.
Okay. So from North Carolina, how did you make your way to the Bonati Spine Institute in Hudson, Florida?
Well, I think I found it on Instagram.
Okay.
And I think it just popped up because I had been searching for something for my back, just something that would make it better. I was trying stretches and following different guys online that taught different stretches. Nothing helped. And I came across Bonati Spine Institute and just thought, well, I'll give it a shot. So
we are glad that you did, because Dr. Bonati changed the industry forever. He created his patented and exclusive Bonati spine procedures, and they are drastically different from everything else in the marketplace. He saw the ineffectiveness of traditional spine surgery and the ungodly recovery and how it really wasn't helping people. He also saw people that had been fused and they had a chain reaction where they needed more and more and more surgeries and nothing was helping. And he almost left spine surgery because he became so disheartened. And then the epiphany of the Bonati spine procedures. Now, why don't you talk about coming to the Institute and what that face-to-face interaction was like with the doctor?
It was great. It was probably the best, especially with my back, visit to a doctor I've ever had. And I'm not just saying that because y'all are doing an interview. It was really so much different. Dr. Wolf was the surgeon. And from the very first time we met with him, he was the first person to really explain what was going on in my back, showed me the MRI. And I've been to, I wouldn't doubt if I've been to 10 different doctors for my back. And he was the first one to really kind of walk me through the MRI, show me what was happening, and show me what Bonati Institute could do to make it better. So that was the big difference for me.
Well, how did you feel? Were you on edge at all? Because, it is surgery.
This guy's a Marine. Do you think he was worried? Come on.
No, I was. Anytime I've had several surgeries, but this was my back, and I've not had any surgery on my back yet. I've put it off, and just know too many guys in the Marine Corps that had to have it, and it made them so much worse after they had it. And so I honestly never thought that I would have it, but it got so bad I had to do something.
Okay.
So yeah, I was a little bit on edge. Any type of surgery, kind of makes you worry. But the anesthesiologist, I wish I could remember his last name. He was phenomenal. And then Dr. Wolf and the staff there, it felt like I had known him forever. So.
And well, let's talk about that. When did you notice a relief of the pain that brought you in? We do everything incrementally, targeting each specific pain. But when did you feel a difference?
Right away. It's really strange because you wouldn't think after having a surgery that you'd get up from the table and just not have any pain. But I got up, and from the first time I got up, I felt better. And honestly, I probably shouldn't tell you this, but the day after my second surgery, we stayed at Wekiwachi.
Yes.
On the water.
Uh-huh.
And I had my 16-year-old son with me, and he begged me to go kayaking with him. And honestly, we live on the water, and I haven't been able to kayak in 7 months. And so I was very careful, didn't let anything get wet. And but I was able to actually do things that I couldn't do just a day before my surgery.
You got into the kayak.
Yeah. I shouldn't tell you all that, but yeah.
Well,
I couldn't put it off. We were watching, and the manatees were going by, so it was amazing.
So here you are, 1 day post-surgery, back in a kayak.
Yeah, but I didn't have to paddle much. My son was with me, so.
Shame on you. When I ask how you are, you're already back to your activities. There was like zero downtime for you. And, following your procedures, how are you now?
Oh, so good. It showed me how bad my right knee is. I got to find someone to do surgery on my knee now. But I haven't even paid attention to my knee much because the back was so bad. But I mean, there's nothing I'm limited to now with my back. It's absolutely amazing.
Well, we appreciate you sharing your story of recovery with us. And when you do things like kayaking or just fun activities, post those pictures on Facebook. We love to see the patients regain their strength and get back in motion.
We'll do.
When you were released from the Bonati Spine Institute, were you told to wear any sort of back brace, anything like that?
No, nothing.
Right, because we don't. We tell people just to get back to it, to ambulate, to move around, and aid the body in the healing process.
To go kayaking and things like that a day after.
That's right.
Don't know about directly after surgery, but hey, you're setting new records for us. So continued good health and healing, and thank you for sharing your story with us.
Yes, ma'am. Thank you. My pleasure.
Take great care. So if you would like to see more stories just like Jonathan's, go to YouTube and search the Bonati Spine Institute. Thank you for listening to the story of recovery. On the flip side of the break, you'll hear what's new in American medicine today.